Hi everyone, many of us were on our screens on 5 p.m. yesterday, so I will not repeat the announcement of Prime Minister Legault and Dr. Arruda, the epidemiology specialists of public health and the government are asking us to give another big blow, and we will do it together from this Saturday until February 8th. The application of these measures requires an individual responsibility of each person, and the supervision is carried out by the SQ. Therefore, the application of curfew measures all over the territory is assumed by the SQ, and they are the ones to be contacted for this aspect. Since the beginning of the pandemic, I have always said that I have no expertise in the spread of the virus, and that I have to trust the guidelines of Quebec Public Health. Their decisions are the result of scientific expertise. I understand that the government's decision may disappoint certain persons, and that it's really not easy to live with. For seniors who continue to be isolated, for parents who must look after their children's online education while teleworking, for merchants, restaurants, hotels, and all their employees, for workers in essential services in healthcare, public safety, or in the municipal sector, for example. It's really not obvious for everyone, and I understand you. But we're all going to have to comply with those decisions. Everyone hopes to defeat the pandemic, and drastic measures like that, there have been them for all over the world since last spring. Regionally, in the last few days, we asked many questions to public health to challenge possible scenarios, to see if Gaspésie, where the situation is under control, could have a special treatment or have an orange color code, or to see if the SQ should hand over roadside checkpoints. Despite all this brainstorming, regional peculiarities are currently being set aside to collectively give a major blow. Currently, all regions are subject to those enhanced measures mainly because all of Quebec shares a single healthcare system. Because people here sometimes have to be hospitalized in Quebec City or in Montreal. Because healthcare workers everywhere can be mobilized to lend a hand where the need is acute. We have to demonstrate solidarity with health workers and the more vulnerable people. So I will not repeat the measures imposed by Quebec. You know them. Curfew from 8 p.m. to 5 a.m., essential service, visit restrictions, schools, etc. My role is now to apply the measures announced last night locally in the municipal fold. So I spoke to public health again, and we brought together our municipal COVID cell to make the necessary decisions in the circumstances. Decisions that will be applied for a limited time until February 8th. First, as telework is mandatory, town hall will be closed. You can reach town office workers by email or by leaving a message on their voicemail. The same goes for the town council. Everything will be done remotely. For applications for permits, construction, renovation, demolition, fishing huts, etc., this will be done by phone at 418-368-2104 extension 8530, or by email at urbanisme, urbanisme, at ville.gaspé.qc.ca. So leave a message and someone will call you back. Invoices must be paid through your financial institutions or by email. By the mail, pardon me. Of course, firefighters are on duty, as are our public work employees who must be operating on the ground to provide essential services such as snow removal, waste, road maintenance, water, sewer, public buildings, etc. Community halls and concert halls have to be closed. Libraries can open. but to protect our volunteers. There will be no self-service and no contact. It will be on reservation with the schedules that will be communicated shortly. Arenas have to be closed. For the pool and gymnasium at the Pavillon des Sports, the decision is up to the Cégep. But when I read the instructions, it will probably be closed. Outdoor ice rinks can open, but with many restrictions. Among other things, only free-to-air activities such as skating are accepted, and organized activities such as hockey will be prohibited. Our 11 ice rinks are operated by as many volunteer committees. We supervise them, but each committee could have specific measures. Thank you for applying them and also for respecting our volunteers. Our volunteers will not replace the police, but everyone has to do their part to follow the instructions. Ski resorts are also run by committees. They can open as long as there is snow, evidently, but comply with the strict guidelines in force. Here too, follow the instructions and respect volunteers and employees. For everything else, while respecting the curfew and avoiding any gathering, fishing on the ice seems permitted, but only one person or one address per cabin. You can also go skiing, snowshoeing, snowmobiling in the vastness of the hinterland. There is nothing to prevent you from going, take a walk or jogging outside, and nothing prevents you from going for a walk with your pet. I think it goes around the decisions that we had to make locally. For everything else, businesses, schools, daycares, etc., it's Quebec who makes the decisions, and I refer you to the public health or to the government. The instructions are quite clear on the website quebec.ca. I will continue to be in contact with the public health and other elected officials to coordinate the regional and national effort. I urge you to follow the instructions of public health experts. We're giving it another big blow. Thank you, everyone.